Hello, my name's Caroline Tweedy. I'm one of the specialist nurses working at Queen Elizabeth, and today we're going to introduce a small video about the cold cap service which is available at the Queen Elizabeth Hospital. It's for patients undergoing chemotherapy. As you might be aware, one of the consequences of chemotherapy is hair loss. So the Queen Elizabeth Hospital provides a service called the cold cap. So the cold cap is used during chemotherapy, and it does help to retain hair. So one of our patients has kindly volunteered to demonstrate how this is used during the treatment.
Chemotherapy-induced hair loss is frequently reported as one of the most distressing side effects of treatment. Patients often tell nurses it alters the way in which they see themselves and the way in which other people see them. Through experience, we know that this can have a negative effect on how patients manage receiving their chemotherapy. Chemotherapy-induced hair loss affects all parts of the body. However, the cold cap may only prevent the loss of hair on your head. Hair loss starts approximately 1 to 3 weeks after the first dose of chemotherapy. The cold cap is only suitable for use with certain chemotherapy drugs, which is why some patients will be offered cold cap and some patients will not. If you aren't able to have or manage the cold cap and your chemotherapy means that you will experience hair loss, your chemotherapy nurses can arrange for you to have a wig. The cold cap uses the coldness of the cap to reduce the flow of blood to the scalp, therefore reducing the exposure of the hair follicles to the chemotherapy drugs. The success of the cold cap will vary from person to person and may depend upon the amount and type of hair that you have, your ethnicity and the fit of the cap and cover. Even with the use of the cold cap, you may still experience hair loss, which is more noticeable when washing or brushing your hair. However, a good result would be that you are comfortable to go out without needing to wear a scarf, a hat or a wig without people being able to notice any unusual hair loss. In order to start the cold cap, the nurses will first dampen your head with warm water, then apply a small amount of conditioner to your damp hair. This improves the contact of the cap with your scalp, and the conditioner stops the cap from sticking to your hair and pulling as the cap is removed at the end of treatment. The cold cap is a cap which sits on your head and is held in place using a cover. The cap and the cover are tight and they need to be very close fitting in order for the cold cap to work. The cold cap is cold. It has to be in order for the process to work. The cold cap will reduce your scalp to a minus temperature. Patients who use cold caps successfully will tell you that the most uncomfortable time is the first 15 to 20 minutes, and you will then get used to the sensation. The nurses will offer you blankets to wrap yourself in as you may feel generally cold. They will offer regular hot drinks and if appropriate will offer you paracetamol if you get a headache. It is important for you to know that cold cap has to be started on the first day of treatment, but also that if you start cold cap and decide it isn't for you, that you can stop it at any time and it will not affect your treatment. If you do stop using cold cap during your chemotherapy, you will, however, still go on to experience hair loss. Following your treatment and the post-chemotherapy cooling period, the nurses will switch off the cold cap, loosen the cap and the cover, but ask you to wait for approximately 10 minutes before you remove the cap and the cover. This will prevent any pulling on the hair as the cap is removed. You can brush your hair following the cap removal, however the nurse will suggest that you use a wide tooth comb to do this. New guidance and improved cold caps mean that you can wash your hair following treatment, however your nurse may suggest that you wait till the following day. You should avoid hair dyes, over-processing and over-styling your hair during chemotherapy treatments to achieve the best results of cold cap.
From my experience, I'm so pleased I did.
It's a good experience.
Yes, yeah.